Ostick here. He's the Chief of Staff, ER physician at Valley Presbyterian Hospital here in San Fernando Valley, Southern California. What are the biggest challenges you're seeing right now from a hospital physician perspective?
Yeah, so coronavirus is obviously front and center of everybody's mind right now. We're seeing a lot of patients in the hospital with COVID. More than 50% of our patients right now are infected. And the length of stay has been so long that it's been very hard to get people out of the ICU to a lower level of care like tele or med-surg. And the tele and med-surg beds are filling up as well. So from my standpoint in the ER, we're boarding patients, ICU patients, tele patients in the emergency department, which is preventing us from getting patients in the front door. So unfortunately, sometimes we're on diversion for ambulance traffic and that sort of thing. So we're hoping that as people get the vaccine and that starts to get going, that we'll see a drop off in our cases and start to get back to some sense of normalcy.
Gotcha. So are you seeing any of the new strain, as they call it? I know there's a couple different strains that are sort of coming into play now. Is that something that's a concern?
Yeah, so not that we know of. At least our test that we use to test for COVID just looks at COVID-19. It's not differentiating between any strains of COVID-19. So we just say you're positive or you're negative.
Gotcha. All right, guys. Well, you heard it here. We're going to go play back nine and stay safe out there.
Wear your mask, social distance, and stay safe.
Absolutely. It looks like Dr. Ostick just joined us.
Let me start video.
There he is.
There I am.
How you doing?
What's up? We've had a decrease in the number of cases with COVID in our hospital. We were over 50% of our cases, about 2 weeks ago. So our beds were just full with patients with COVID that their length of stay is long, and we were having trouble getting patients upstairs that were coming into the hospital. We were on diversion. And so that was an issue. But good news is that we've seen a downtick in LA County at least. And now we are under 50% of our admitted patients have COVID. And that leaves some more room in the hospital for patients to come in and to get patients kind of moving through the process, which is great. And so I think that this is light at the end of the tunnel. I think a big part of it is that we've had a lot of people in LA County get infected already. So they're hopefully protected with their own antibodies. And then we've started the vaccination program, especially for healthcare workers and for patients over 65 years old. And so I think that combination is really going to help us kind of get to the other side of this pandemic. And so I'm hesitant to say that we're kind of through it yet, obviously, but I think we're on the other side of it.
A lot of analysts on Wall Street, obviously, they're really good at tracking the market. And they've been, looking at healthcare data, as you might not be, super surprised about. And a lot of these analysts are saying that, basically, and they're getting information from providers as well, but basically based on the rate of vaccination that's happening right now, immunity that already exists, and the herd immunity that's going to happen at the same rate the vaccines are happening. They're saying that the economy should be like 95% back open by about June of this year. Does that sound about right to you?
Yeah, I hope so. We've been saying that summertime sounds like we'll probably be in a very good spot. I think for sure by fall. But yeah, absolutely. Now that depends on, like you said, the herd immunity, but also people going out and getting the vaccine when they're able to. Unfortunately, we've had some, people that we've heard that are refusing it for whatever reason, that they're scared about it, they don't trust it, they don't think it's safe. And I just want to say for anybody that's listening to this, it is very safe, very effective, and we would recommend that you get it whenever you're able.
It's not much different than a flu shot, correct?
Yeah, I mean, it produces protein in your body that looks like the spike protein on the COVID virus, and so your body makes antibodies to that spike protein, and so it's not a live virus.
Dad, I'm gonna head over there.
It's not a live virus, so it can't get you sick. It's only going to make you make antibodies to the virus to help prevent you from getting it if you get exposed to COVID. So absolutely safe, absolutely effective, even more effective than the actual flu shot. If you get both of the COVID vaccines, you're 90% protected. It's about 90% effective, and flu shot every year is about 40% effective. So much more effective than the flu shot. So absolutely go ahead and get it. I got it myself and really had some muscle soreness at the injection site, and that was about it. No other symptoms.
Yeah. Well, if anything, it helped your golf game.
It didn't help my golf game at all. But I will say, and this is important, golf has been something that I can use to relax from a physician wellness standpoint. That's something that's important to me about taking care of your mind, taking care of your body. And we are in a stressful we're in a stressful business in medicine. You guys are in a stressful business with what you guys do. And it's really important to take care of yourself, take care of your body. And if that is going out there and hitting golf balls after a shift for me and relieving stress, it is an awesome way, I think, of kind of keeping your mind, your body healthy.